Hello, coders. Good morning, good evening, good afternoon, all depending upon where you're joining us from. Welcome to another 3030 session by AMCI. So, before I move further, let me know, coders, how do I sound? Am I audible? Is my audio good? Welcome, everyone. Okay, thank you for letting me know. And coders, in this session today, we will be reviewing the immunization. Yes, the immunization administration for vaccines and toxoid, which is an essential topic for every medical coders. So we will walk you through the CPT coding guideline, understand the difference between the vaccine product codes and the administration codes, and also explore real world scenarios to help you code accurately and confidently. So let's dive in and break down how to report immunization administration step by step. So before we jump into the coding portion, let's first understand what exactly we are coding for. So what is a vaccine, coders? Yes, a vaccine is something that teaches our immune system how to fight a disease. It usually contains a weakened, inactivated, or even a small part of a germ, just enough for our body to recognize it, but not enough to make us sick. So, this way, our body builds the immunity and remembers how to fight that infection in the future. So, now what about a toxoid? Think of a toxoid as a special kind of vaccine. It is made from inactivated bacterial toxins. They can cause any disease, but they still help the immune system learn how to defend those toxins. So, most famous or most common examples, we can say a tetanus toxoid or a diphtheria toxoid. And sometimes we also hear about other immune products. Let us keep it simple. Immunoglobulin. So these are ready-made antibodies, like a quick protection shot when someone is already exposed to something such as a rabies or a hepatitis B. And there is serum, which is an antibody-rich fluid, blood fluid, which is used in special treatment, such as a snake antivenom. And also we have recombinant products, which are lab-made proteins that act like natural immune component. For instance, a recombinant hepatitis B vaccine. Okay, all right, coders. Now that we know what vaccines are, let's talk about how they are given. Yes, the route of administration. So different vaccines are delivered in a different way. And as coders, knowing the route is very important because it affects how we report the CPT code. And here are the main type of vaccine administration routes. First, you have an intramuscular route. This means the vaccine is injected into the muscle, usually a deltoid or a thigh muscles. We have a subcutaneous route. Here the vaccine is injected just under the skin. We have intradermal route. This one goes into the top layer of the skin like tiny bubble under the surface. We also have peroral route. So some vaccines are also given by mouth. For example, a polio virus vaccine. We also have an intranasal route, and some of them also given through the nose as a nasal spray. So an example is live attenuated influenza vaccine, or commonly known as flu mist. So remember, coders, administration isn't just a clinical information. It is also key for choosing the correct CPT code when you're coding vaccine administration. Okay, now coders, here is something very, very important to remember when coding for immunization. You always needs two codes for every vaccine service. The first one being the product code, and this tells what is being given, the actual vaccine or toxoid that is inserted into the body. Okay, so this is an actual medicine. Second, the administration code, and this tells how it is being given. So if you capture both the product and the administration code correctly, your vaccine coding will always be accurate. So to code a vaccine or toxoid, you must know the difference between the vaccine component and a combination vaccine. So what is a vaccine component? So a vaccine component is all the antigen that make up a single vaccine. So basically what your body is learning to fight. Let's take the example of measles vaccine. Let me know coders, how many components are there in a measles vaccine? Type your answers in the chat quickly. There is only one component over here. Okay, now let's look at what a combination vaccine is. So a combination vaccine is made up of multiple vaccines combined into one shot, and each vaccine included counts as a separate component. Let's take the example of MMR. You have measles, mumps, and rubella. That means there are three components. So coders, it is very important to know the difference between a component and a combination vaccine. Okay, when coding, also a quick tip, when coding vaccines for patients 18 year and younger, the doctor provides counseling. You must identify each component of a combination vaccine and code the administration for each component separately. So we will be doing some exercise based on these guidelines, and we will look a little bit more deeper into it on the coming slides. So coming up next is a exercise, and I want everyone to join with me in the chat, and you can answer how many components are there present in these vaccines, these combination vaccines. So first we have MMR. Type your answers in the chat coders. How many components are there in an MMR vaccine? Okay, great. Excellent. Yes, we have three components in an MMR vaccine. You all are perfect. Correct. Absolutely correct. And they are measles, mumps, and rubella. Excellent. Let's look at another example. DTP. What do you say, coders? How about a DTP? How many components are there in a DTP? Okay. Okay. Any more answers? We have three components actually. We have diphtheria, tetanus, and pertussis. So there are three components in a DTP vaccine. Great try, great try. Good job. One more. HIP. What do you say, coders? How many components are there in an HIV vaccine? Okay. HIB vaccine. Mhm. Yes, absolutely correct. There is only one component, and that is Haemophilus influenza type B. Spot on, spot on. Okay, great job with that exercise. Now let's talk about vaccine administration CPT code. So when coding vaccine administration, it is important to select the correct CPT code based on the patient's age, counseling, and route of administration. So there are three primary vaccine administration CPT code. The first one is 90460, and it is used for a vaccine administration for the patients 18 and younger. And for 90460, doctor provides a vaccine counseling, and it codes for the first component of each vaccine. So this is a very important point. 90460 codes for the first component of each vaccine. So if you have an MMR and TTP, it codes for your MMR has three components, namely measles, mumps, and rubella. And TTP has also three components we just saw in the last slide: diphtheria, tetanus, and pertussis. So 90460 codes for the first component of each vaccine. So here there are two vaccines, and 90460 codes for measles and diphtheria. So they are the first components of these two vaccines, right? Okay. And for route of administration, it can be used through any route of administration. Now let's look into the next CPT code 90471. So they can be used for any age group. No counseling is needed. And these codes for the first vaccine or toxoid. Again, coders, note the difference. 90460 is only for the first component of each vaccine or toxoid, while 9047 is for first vaccine or toxoid. Sorry, yeah, it's for the first vaccine or toxoid. And they can be also given by nurse. And the route of administration is intramuscular, subcutaneous, intradermal, or percutaneous. And then we have 90473, which can be also used for any age group. No counseling is needed. Codes for the first vaccine or toxoid, and the route of administration would be oral or intranasal. Okay, so these are the three primary vaccine administration CPT codes. Now, let's move our attention to the add-on codes. So in addition to the main administration code, there are add-on codes for extra components or vaccines that are used. And 90461 is used for each additional component of the vaccine when counseling is provided. And 90472 is used for each additional vaccine when no counseling is provided. And then we have 90474, which is also used for each additional vaccine when no counseling is provided. So coders, it is very important to know whether counseling has been provided or not, the age group of the patient, as well as the route of administration. Okay, so let's move on. And next, let's have a quick look at the immune globulins serum recombinant products coding, and the codes 90281 through 90399 identify the products that are either derived from the human plasma or lab engineered recombinant products. And this includes the immune globulins, antitoxin, isoantibodies, and monoclonal antibodies. And all are used for the treatments or prevention of various conditions. So whenever you report for these code, similar to the vaccine toxoid administration, you always need two codes. One, the product, and two, the administration code. So the appropriate administration code for immunoglobulin serum and recombinants are 96365 through 96375, depending upon the route and method of administration. And an important point here to note is that a modified 51 should never be reported with these products, even if another procedure is performed at the same encounter. Okay, so that's all about immune globulins, serum, or recombinant products. Now let's have a look at COVID-19 vaccine CPT coding. So COVID-19 or coronavirus disease, as you all know, is caused by SARS-CoV virus 2, and it was first identified in December 2019, and rapidly spread around the world, leading WHO to declare it as a global pandemic in March 2020. So the virus mainly spreads through the respiratory droplets and close contact with the infected peoples. And the common symptoms are fever, cough, fatigue, shortness of breath, and in even severe cases may result in pneumonia, acute respiratory distress syndrome, also multiple organ failure. And regarding the COVID-19 vaccine, there has been an update in 2025, and many of the CPT codes for COVID-19 vaccines have been deleted and replaced with new codes in 2025. Okay, so all the codes has been deleted from a lot of codes from 2024 has been deleted. So make sure you have CPT manual, 2025 CPT manual with you. And previously there were many CPT codes for COVID-19 vaccine administration as well. Now all of the old codes are gone or deleted, and we have only one code for COVID-19 vaccine administration, that is 90480. And this code is used for the intramuscular administration of a single dose COVID-19 vaccine. Okay, so we have only one administration code for COVID-19 COVID-19 vaccine. And for COVID-19 vaccine coders now use specific product codes to identify the type and dose of the vaccine. So the vaccine product codes differ based on the vaccine type, the formulation, and the dosage. So we have code 91304, which is for a recombinant spike protein nanoparticle, saponin-based adjuvant 5 mcg per 0.5 ml intramuscular route of administration. Then we have code series from 91318 through 91320. So these codes are all coding for mRNA LNP COVID-19 vaccine with the spike protein, Chris Socrates formulation. And these codes differ only by the dosage. 91318 is for 3 mcg per 0.3 ml, while 91319 is for 10 mcg per 0.3 ml. We have 91320 for 30 mcg per 0.3 ml. We also have the codes 91321 to 91322, and these are also for mRNA LNP COVID-19 vaccine, but they differ in their dosage and the volume. 91321 for 25 mcg per 0.25 ml intramuscular route of administration, and 91322 for 50 mcg per 0.5 ml intramuscular route. So remember, coders, always pair the product code with 90480 for intramuscular administration, and you have to verify the exact dose and formulation before coding. And all the older COVID-19 administration codes have been deleted, so only use 90480. So next, let's summarize the vaccine coding CPT for both COVID and non-COVID vaccines. The administration code 90480 is used for intramuscular injection of single dose COVID-19 vaccine, and the codes 91304, 91318 through 91322 are for COVID vaccine product codes. And for non-COVID vaccine, yes, the administration code include 90460, 90461, and 90471 through 90474. And the vaccine product codes range from 90476 through 90759, covering various non-COVID vaccine toxoids and toxoids. Okay, so finally, let's have a look at our FTRs. So two codes are required. Always remember that. One is a product code, and that is listed first, followed by the administration code. 18 years old and under with counseling for non-COVID vaccines use 90460 and 90461. No counseling for non-COVID cases use 90471 through 90474. Each immunization component should be coded separately. Product codes other than SARS-CoV-2 use 907476 through 90759, and the admin codes other than SARS-CoV virus vaccine use 90476 through 90759, 90460, 90461, 90471, 90472 through 90474. And COVID product codes, COVID-19 product codes, you have 91304, 91318 through 91322. COVID admin codes, there is only one administration code, that is 90480. Also, do not report the 90476 through 90759. These are known COVID product codes in conjunction with 90480, which is a COVID vaccine administration code, unless both the SARS-CoV-2 vaccine or toxoid and at least one vaccine or toxoid products from 90476 through 90759 are administered at the same encounter. And also note, E&M services should be coded separately with a modifier 25. Okay, that is great. So now we are done with the FDRs. It is time for some coding exercise. Are you ready, coders? Yes. So here we go. Let's do this one. And I will read the last portion of the question and followed by the answers. Then I will move on to the question. So we have, of the following, which best describe the code of best describe the vaccination service? Option A, 90716, 90713, 90460 times 2. Option B, 90716, 90713, 90471, 90472. Option C, 90716, 90713, 90473, 90474. Option D, 90716, 90713, 90460, 90461. Maria brought her 18-month-old daughter to the pediatric clinic for her delayed 15-month immunization. Physician reviewed child's vaccination record and explained the importance, benefits, and possible reaction of upcoming vaccines. After providing appropriate vaccination counseling, physician administered inactivated polio virus vaccine, which is IPV combination vaccine, and a varicella vaccine single subcutaneously. Of the following, which best describe the vaccination service? And coders, I will give you around about 2 minutes to answer this question. And your time begins now. I can see the answers are already in the chat. Okay, let's see. Okay, Codus. That's what I say. That's what all I have to say. Be forensic. So I can see a strong race between option A and option D. Okay, so this is going to be an aha moment. And let's break down this scenario. So here in the diagnosis inventory, we have a patient for the encounter of for immunization. And in the procedure inventory, I have an inactivated virus vaccine, which is given subcutaneous, and varicella vaccine that is also given subcutaneous route. Okay, that's what I have here. And what I would say is always, I believe all the guidelines, the knowledge of the guidelines is the real strength. So by knowing the guidelines, I can eliminate some of the wrong answers just by knowing guidelines. And the guideline states that, okay, before that, let's ask some questions. What's the age of the patient here in the scenario? It's 18-month old, right? 18-month old child. And was there any counseling given? Yes, there was a vaccination counseling given, right? Yes, there was a vaccination counseling given. And how about the route of administration? Yes, both vaccines were given by subcutaneous route. Now, the guideline states that for 18-year-old and under with counseling for non-COVID vaccine, you can use CPT code administration code 90460 and 90461, right? So the guideline and the criteria are met for using administration code 90460 and 461 here or 461 here. So we have a patient of 18 months, counseling given. That means option B and option C both are incorrect. I don't even need to open my books because I know that 90471 and 473 should not be used in this scenario, right? They should be used for cases where no vaccine counseling was given, and also for the cases, yeah, when no vaccine counseling was given. And here the vaccine counseling was given, and the age of the patient is under 18. So option B and C straight away is incorrect. Now, now comes the question, which is the correct answer between option A and option D? Yes, I know you all are eager to see which is the correct answer. So let's see. So we know the guideline says that each immunization and component should be coded separately. And CPT code 90460 is coding for immunization administration through 18 years of age via any route with counseling by physician or other qualified healthcare professional first or only component of each vaccine or toxoid administered. So 90460 should be used for first or only component of each vaccine or toxoid. Now let me know, coders, in the chat, how many components are there in IPV, inactivated poliovirus vaccine? Let me know in the chat. Hello. We have only one component, right? How about the varicella vaccine? And in varicella vaccine also there is one component. So 90460 should be used for first, either first or only component of each vaccine or toxoid. So you have to use CPT codes 90460 twice, which covers one component from both of these vaccines. And that makes option D incorrect and option A the correct answer. There you go. Yes, that was a aha moment. And that is the reason why I said in the beginning, it is very important to know the difference between a component and a combination vaccine. Okay. Okay, great, great job. So let's move on and let's do another scenario. So we have got few good scenarios here today, and here's another scenario for you all. Okay, of the following answers, which best describe the vaccine administration? Option A 90700, option 90700, 90713, 90460 times 1, 90461 times 3. Option B 90700, 90713, 90460 times 2, 90461 times 2. And option C 90700, 90713, 90471, 90472. Option D 90470, 90 sorry 90700, 90713, 90471. Mother arrives to the pediatrician's office for the first time with her 2-month-old baby girl for the administration of diphtheria, tetanus, acellular pertussis, DTaP, and inactivated polio vaccine, which is IPV. Informed consent was obtained from the guardian. The skin at the selected injection site was cleaned using alcohol swab and allowed to air dry. Using a sterile syringe and needle, diphtheria, tetanus, acellular pertussis, DTaP, and inactivated poliovirus vaccine was administered using intramuscular route with steady, controlled pressure to ensure accurate delivery of the following, which best describe the vaccine administration. And Coders, your time to answer this question begins now. Once again, I will give you around 2 minutes to place your answers. Okay, Coders, B, forensic. And Coders, you all are on fire on this scenario. Excellent job. Okay, let's break this down again. So we are here also we have patient for the encounter of immunization and procedure inventory. Two vaccines was given, DTaP and IPV. So DTaP is for diphtheria, tetanus, acellular pertussis vaccine, and IPV is for inactivated poliovirus vaccine. Okay, let's ask those questions. What's the age of the patient in this scenario? The answer is 2-month-old baby. How about the counseling? Was a counseling given? Was a vaccine counseling given to the patient? No, right? There is no documentation. There is no clear documentation that a vaccine counseling was given. Okay, yes, there was no documentation. And if it's not documented, it is not done. So we should not assume anything. And how about the route of administration? It's an intramuscular route. Yes, both injection was given intramuscular using an intramuscular route. Okay, again, the guidelines comes to play here. For 18-year-old and under with counseling, we can use CPT code, administration code 90460 and 461. And as we said, there was no counseling in this scenario. So if no counseling is given, you have to use a code series ranging from 90471 through 90474, right? So again, using this guideline, I can eliminate option A, option B, both are coding for 90460, for which the criteria is that we should definitely have a vaccine counseling. And there was no vaccine counseling given in this scenario. That leaves us with option C and option D. Okay, so both options. So here, no counseling given. So option A and option B is incorrect. And 90700 codes for the diphtheria, tetanus, toxoid, and acellular vaccine, and 90713 is for poliovirus inactivated vaccine. Okay, so both are correct. And now let's turn our attention to the administration code. Both option C and D is coding for 90471, and that is for immunization administration of one vaccine. Okay, and we had two vaccines given here, right? In this scenario, there was two vaccines. One was DTaP and inactivated poliovirus vaccine. So there was two vaccine given, and for that we have to use an add-on code, which is for each additional vaccine, or a single or a combination vaccine. And that is why option C is the correct answer. So option D is only coding for one vaccine. Okay, how are you all doing, coders? How are you all doing? Great. Okay, let me know in the chat, how are you all doing? And in meanwhile, let's move on to another good scenario. Okay, of the following answers, which best describe the vaccine administration? Your options are option A 90707, 90713, 90460, 90461, option B 90707, 90713, 90471, 90472, option C 90707, 90713, 90471, 90472 times 3, option D 90707, 90713, 90460 times 2, 90461 times 2. Emma, a 2-month-old infant, is brought to the pediatric clinic for her scheduled immunization. The physician reviews her vaccination record and provides counseling to the parents about the importance, benefits, and possible reaction of upcoming vaccines. MMR combination vaccine subcutaneously, and IPV single vaccine, which was given intramuscularly. And of the following answers, which best describe the vaccine administration or vaccine service? And coders, once again, your time begins now. You've got 2 minutes to answer these questions. Okay, coders, I know that you all are thinking now, trying to answer. Okay, so let's go ahead and let's solve this one together. Okay, here we go. So we are having a patient for the encounter for immunization, and here also we have two vaccines that have been given. One is a combination vaccine of MMR. We have measles, mumps, and rubella, a combination vaccine that has been given subcutaneously, and also we have a IPV, which is single component vaccine that has been given by intramuscular route, right? Okay, now let's ask the question: age of the patient. What is the age of the patient? And I say it is 2 months old infant. Counseling given or not? Yes, there was a documentation that a vaccine counseling was given. How about the route of administration? We have one vaccine which is given subcutaneously and the other given intramuscularly. Okay, so let's take our guidelines and let's try to solve the scenario. So the guideline states 18-year-old and under with counseling. Use CPT codes 90460 and 90461. So we can clearly see that counseling was given and the age of the patient is less than 18 years. So definitely we have to use 90460 or 461 here and not 90471. So option D and option C are incorrect. Okay. And each immunization or component should be coded separately, right? Yes. So you need to identify the component that make up a combination vaccine and code the component separately. So let's have a look at code 90460. 90460, as I said previously, is coding for first or only component of each vaccine or toxoid. So we have two vaccine given in our scenario and MMR and IPV. So MMR, let me join with me coders in the chat and tell me how many components are there in MMR? Three, right? Do you agree? Yes, MMR has three components: measles, mumps, and rubella. And IPV is a single component vaccine. So we have two vaccines given, and 90460 should code for the first or only component of each vaccine or toxoid. So we have two vaccines, and the first component of the two vaccines should be coded with for 90460. So 90460 times 2, and in addition we have uh, mumps and rubella as well. So for that two components you use 90461 times 2. Okay, so 90460, I've written it wrong. So in option D, 90460 times 2 codes for your measles and IP, which is the first component of both vaccine. And 90461 is coding for the other two components. So that should code for your mumps and rubella. And that makes option T the correct answer. So option A is only coding for a one component, one add-on component. We had two add-on components here. And that makes option D the correct answer. How are you all doing, coders? How are you all doing? Okay, okay. So we are referring the CPT coding guidelines here for solving these scenarios. Okay. So let's move on to the next scenario. I got one more coding scenario for you all, and here it is. Okay, got it. So if you have any doubt, please place it in the chat and we are here to help you. Okay. So of the following answers, which best describe the vaccine administration? Option A 91321 90480, option B 91322 90480, option C 91320 90460. Option D, 91321 90471. John Doe, an 8-year-old boy, arrives at the pediatric clinic with his mother for scheduled COVID-19 booster vaccination. The nurse verifies his identity and reviews his vaccination history. After assessing his eligibility, the healthcare provider approves the administration of SARS-CoV-2, which is COVID-19 vaccine, mRNA LNP, and at a dosage of 25 mcg per 0.25 ml, given intramuscularly in the deltoid muscle. Following the injection, nurse monitors John for 15 minutes to observe any potential adverse reaction. Of the following answers, which best describe the vaccine administration or the vaccine service? And Curtis, I know you will be. This is much more straightforward. Still, I will give you 2 minutes. Curtis, place your answers in the chat. Okay, Curtis, I can see some of the answers are still coming through. So let me walk you through this one. Okay, great, good answers. Okay, so here the patient arrives for the encounter of COVID-19 booster vaccination. And procedure inventory, we have a COVID-19 mRNA LNP 25 mcg per 0.25 ml. Okay, and we all know that COVID administration codes, we have only just one COVID administration code, and that is 90480. So if you know that guideline as well, you can eliminate option C and option D, right? Option C is coding for an administration code of 90460, and which is for a non-COVID vaccine. Also, option D, 90471, that is also for a non-COVID vaccine administration. So both are incorrect. We are left with option A and option B. Both are for 90480, which is a correct administration for COVID-19 vaccine. All we have to do is to find a correct product code. Okay, and option A is for coding for a COVID-19 vaccine mRNA LMP 25 mcg per 0.25 ml dosage for intramuscular, while 91322 is for an mRNA COVID-19 vaccine mRNA 50 mcg per zero point 0.5 ml dose intramuscular route. All we have to do is to cross check with our procedure inventory, and the procedure inventory states that doctor used a 25 mcg per zero point 0.25 ml dose, which means option A is the correct answer and not option B. And as most of you have said, I can see only option A in the chat. Yes, 91321 and 90480 is the correct answer. Okay, great job. So let's continue. Let's continue and do some more exercise, coders. Okay, again, this is a exercise to find out number of components in these vaccines. Okay, so here we go. First comes hepatitis B vaccine. So let's be quick, coders. Quickly place in the chat how many components are there in hepatitis B vaccine. Okay, exactly. Yes, there is only one component, and that is hepatitis B. How about MMR vaccine? MMRV vaccine. Be forensic. MMRV vaccine. How many components are there? Okay. Okay. Yes, there are four components, namely measles, mumps, rubella, and varicella. Yes. How about DTAP HIV combination vaccine? DTP HIV combination vaccine. Yes, there are four of them. Diphtheria, you have tetanus, you have pertussis, plus there is an HIB as well, right? So you have to you have one more component additional in addition to the DTAP, which would be HIB. So there are four components in DTAP HIB. Rotavirus oral vaccine. Rotavirus oral vaccine. Yes, you have only one component, and that is rotavirus. Okay, so I hope this exercise helped you to identify number of components in each vaccine or in a combination vaccine. Okay, so as you saw, that is very important to code. And next we have some hand poll question. So I will go through some of them quickly. Which administration code is used for COVID vaccine for all age groups among these? Is it option A 90460, option B 90461, option C 90471, or option D 90480? What do you say, coders? Okay. Yes, it is option D 90480. Right? Okay, I was just reading through one of the question in the comments. Yes, you can. Yes, 90480 is the single administration code for COVID-19 vaccines for all age groups. So I got another one for children whose age is equal to or younger than 18 years old receiving a non-COVID vaccine with physician counseling. Which administration code should be used for the first component? Okay, that is easy. Okay, coders, let me know. Yes, the correct answer is option A. There you go. Yes, correct. 90460 is for the first component of the vaccine with counseling by a physician or other qualified healthcare professional. Excellent job. Next question. If a combination vaccine has a multiple component, how do you report the additional components? Do you use 90460, 90461, 90471, or 90480? What you say, coders? And the correct answer is option B, 90461. Yes, 90461 is used for each additional component of a combination vaccine when counseling is provided. Okay, great. Great job. Great job, everyone. Next one. Which of the following should not be reported with vaccine or immunoglobulin product codes? Is it option A, 90460, 90461, 9043665, 96365 to 96375, option C, 90471 through 90474, option D, 90480? Okay, you know what, coders? I think there should be a modification to this question, right? Which should not be used, should not be reported. It should be which of the following should not be reported for a vaccine products other than immunoglobulin? Because I see that option B is coding for 96365 through 96375, and 96365 through 96375 should be used for administration for immunoglobulin, monoclonal antibody, and serums, right? Yes, so these are the administration codes which should be used when we have a product codes from immunoglobulin, monoclonal antibodies, and serum. Okay, next one. Which administration code would be used for a non-COVID vaccine given to an adult of age greater than 18 without counseling? The options are option A, 90460, option B, 90461, option C, 90471 through 90474, option D, 90480. Yes, you all are spot on. It is option C. So no counseling for vaccine adults, adult vaccine, non-COVID cases. You have to use 90471 through 90474, depending upon the route of administration and number of vaccine. Okay, and 90480, that is for a COVID-19 vaccination, right? And you know that 90460 and 461 should be used only for the cases where we have a counseling given. Great. Okay, I think this is going to be the last one. Last hand poll questions. Okay, coders, all the best. Which route of administration is not included in codes 90471 through 97474 for non-COVID vaccine? Is it option A, intramuscular, option B, subcutaneous, option C, or oral or peroral, or option D, intravenous? Venous. Okay, coders, let me know in the chat. And the correct answer is option D, intravenous. No, that route is not given in your CPT code descriptions, right? No, not intravenous route. Yes. So 90471 through 90474 covers your intramuscular, subcutaneous, intradermal, and oral or nasal routes, and not an IV route. Yes, that's totally out of the box option, not IV route. So excellent job, coder. So I will be placing the survey links in the chat. So if you enjoyed the video, smash that like button, subscribe, and share it with someone who need to see this. Okay. So till next time, stay safe, keep coding, and we will be back with another great topic next week. Okay, coders. So I'll be dropping the survey link in the chat.